We're told nurse stress is just part of the job. The reality is far more dangerous than most realize. It goes beyond hospital walls. Nearly half of all nurses have faced public violence or aggression. But the greatest threat may be internal. 74% of nurses feel emotionally exhausted multiple times a week. This isn't just feeling tired, it's burnout, a state of total emotional, mental, and physical exhaustion. We'll expose the myths, see the hidden physical damage, and show you proven ways to reclaim your well-being. The problem begins with a myth. The nurse is a tireless superhero. This ideal is a direct path to burnout. And there's compassion fatigue, a specific drain from absorbing the constant trauma of others. This is a systemic failure, not a personal one, driven by understaffing and impossible workloads. So we have systemic pressure and emotional drain. But what is this actually doing to your body? Chronic stress is a physical attack. It floods your system with cortisol, a hormone that over time literally scars your blood vessels, increasing risk of heart disease. A major cause of this damage is shift work. Working nights or rotating schedules attacks your body's natural clock, your circadian rhythms. This isn't just about feeling off. This prolonged disruption is linked to serious health risks, including cardiovascular disease and certain cancers. The long-term risk is clear, but in a moment you'll see how this physical breakdown affects your patients right now. The link is direct and dangerous. Unmanaged nurse stress is proven to increase medical errors. Exhaustion clouds judgment and slows reaction times. This risk grows with small mistakes born from stress, like poor shift reporting that creates information gaps and immediate anxiety. Another trap is reactive time management. Without a quick plan, you are vulnerable to overwhelm when the inevitable crisis hits. So your internal physiological state has real external consequences. But who is most at risk for this breakdown? Surprisingly, the newest nurses are hit hardest. 28% of Gen Z nurses report feeling burnout every single day. Worse, a quarter of them refuse mental health support, fearing it will damage their careers or that their struggles won't stay private. This fear is based on a damaging myth that mental struggle equals incompetence. It is a human response to inhumane stress. We've seen the scale of the issue, the physical toll, and the barriers. How do we fight back? It starts by changing the narrative. Let's connect two ideas: the superhero myth and systemic failure. The myth is the tool the system uses to justify its own failings and avoid accountability. Now connect two more points. We rejected the idea that seeking help is weakness, and we saw how stress physically harms your body. Therefore, seeking mental health support is preventative care for your heart. Fighting for better conditions is fighting for patient safety. Understanding this is the foundation. Now, what are the proven tools for this fight? One of the most effective is mindfulness-based stress reduction, or MBSR. It is a structured program proven to lower emotional exhaustion in nurses. To combat compassion fatigue specifically, practice intentional self-compassion. Studies show self-kindness increases coping skills. Taking time for yourself is not a lack of dedication. It is a non-negotiable requirement for professional longevity in providing safe care. You face external threats and internal battles daily, but by understanding the system and using these strategies, you can overcome these challenges. Start small. Take 5 minutes for mindful breathing. Research an MBSR program. Acknowledge one difficult moment with kindness. For administrators watching, investing in these programs is not a perk. It's a vital patient safety and risk management strategy. Your well-being is the foundation of our healthcare system. Defend it fiercely. Share this video with a nurse who needs this message. You can find resources and links in the description below. Thank you for the work you do.